Hi, welcome to All Things Home Care with Dana Arnone. We are out and about in Bay Shore, Long Island. We are at Best Care, which is a home care agency located on Main Street in Bay Shore. And we're here to talk about home care and engaging nursing students and fast-tracking them through the home health aide curriculum in order to get them working and help out with this staffing crisis that we're having right now. So let's take a listen and let's go inside. We are at the office of Best Care, which is a licensed home care agency. I'm sitting here with Eileen Rabinowitz and Michelle Lee.
I'm the Vice President of Clinical Services. I'm a nurse. I've been with Best Care 15 years.
I'm also a registered nurse, and I'm the clinical program manager, and I receive the nurses in all the offices.
One of the things that we're here to talk about today is really how to engage the community and other and individuals into the field of home health care. One of the partnerships that Reliance has created with Best Care is fast-tracking the nursing students through the home care curriculum. So why don't we talk about that a little bit and exactly what is fast-tracking a nursing student?
Best Care has a training program, a home health aide training program, which allows the nursing students to fast-track and to become home health aides based on their competencies.
I was a home health aide and I was a CNA, and having that flexibility of the schedule really allowed me to be able to go to school full-time and work full-time because I needed to pay for school. So I think that it's such a good idea to to engage nursing students and let them know that there is a way for them to start building their resume now and get into the workforce. And really, for me, it's also creating that nurse, that empathetic nurse, that realizing when they're discharging somebody that where they're discharging them to, because now they're going to be working in the homes.
I also think it helps them hone their assessment skills, which is the most important thing with home care nurses, because you're out in the field, you're not in the hospital with all your fellow nurses, and you have to make decisions based on what you see. So the experience they get working as an aide, which to us is the most important role in home care, is invaluable.
Right. And absolutely, they build their clinical skills, they build their clinical foundation, they build their critical thinking skills, and either way they hone their skills and they become better nurses, they become better quality nurses
100%.
In the long run.
At Reliance, what we do is we actually go to the colleges and we talk to the nursing students and we try to get them, engaging them into home health care. Even as a career as a registered nurse, to me it's a no-brainer. That's one of the things that really helped me in my career, was being an aide first and really put me in that path of where I was going to end up, which is sitting here with you. But so let's just talk a little bit about the actual skill set in the program. So if someone is a nursing student, they have to complete year one, fundamentals, like what is it that they have to?
They can come to our office, any of our offices, and they take a competency written test, and once they pass that, they do the competency skills demonstration, where it ranges from personal care skills to ambulation and transfers. And once they finish that, they get a New York State authorized certificate as a home health aide.
That's great. So normally the home health aide course is how long?
It depends. If you're going for an HHA, it's a minimum 16 days, 105 hours.
Oh, one of the things that I used to hear a lot with the nursing students before we found out about this was that, I don't have the time to take the home health aide. I'd love to become a home health aide, but I don't have the time. I don't have the time to give. I'm in nursing school and that takes up all of my time. But to have the ability to have them fast track it in about a day, because they've already taken most of the stuff that goes on in home health aide class through the nursing program, that they're able to take this test, skills test, the written test, in about a day or so, maybe 2 days tops, and then start working, which is so much easier for them, especially, given the time restraints that they have in nursing school. So one of the other things that I know about Best Care, same as Reliance, is that we're both union agencies. So why don't we talk a little bit about the benefits of working for Best Care or Reliance as it relates to the union?
Well, the union has a lot of programs in place for aides that want to go to nursing school, from some financial compensation to other programs for placement. They have a great education fund, even in terms of medical insurance. The union has some great programs in place. So for a nursing student that's working, going to school, and maybe has a family, I think the union can offer great support for them.
On Long Island, the union is not spoken about a lot. It's not something that's, especially in home care, maybe in the nursing homes and hospitals, everybody knows $11.99, but in home care, when we tell them that we're $11.99, they're all like, oh, they don't really understand what that means. But having the ability to, have tuition reimbursement and the health insurance and all those things while they're going to school, they should really, that's such an added bonus. And the thing for me is also the flexibility of home care. You can work on the weekends, you have the night shifts, 4-hour shifts, so it really does create a very nice holistic package for a nursing student to be able to continue in their career.
And also, once they're out in the field, clinically they have all the support. They have from the coordinator to the administrator and even the nursing staff. And so it's a good point for them to know that once they're in the home, they're just not by themselves, that there's always a resource.
So I know that we had one student come already, right, from nursing school. So he already took the written test, and he's waiting to take the skills test. And he's so eager to start working and really starting engaging into the position of home care worker. He was telling me that it was very hard for him to find a job that fit into his schedule for nursing school. So when he heard about this and fast tracking, he just thought it was such a smart thing. So he's really eager and so happy to be able to become a home health aide worker.
I think what you're doing is great. The fact that you're out there with the schools, getting them engaged, just for the experience the nursing students get, as well as the opportunity to work in their field now. I think it's a wonderful thing.
Well, we're looking forward to October because that's when we start the syllabus with Farmingdale. Healthcare in general, we have to rely on the youth, right? That's who's coming in, and that's who we got to start engaging them in these different opportunities. Everybody thinks nurses have to go into maybe hospitals or sometimes an ambulatory situation, but they don't really think about home care as being something that's really engaging. And so normally Best Care has a training program offered here, free to people in order to come to school. So what is that? What are you guys doing with the training program right now?
So we have a long-established, state-approved training program. Over the years, we really never had to advertise. We would have people come in because it's free. We give away the book. We're very supportive when they graduate. We give them scrubs with the name. And for a lot of people, graduating and getting a certificate might be the first time they've accomplished such a thing. So we make a fuss. We have a graduation and a celebration before they go to work. Because of COVID and some other economic factors, unfortunately now it's hard to fill a class. We're limiting the size because of social distancing. So where we never had to do much before, we're advertising, we're offering financial incentives for referrals, and we're working hard to try to fill the classes because obviously we all know what a need there is for home care workers in New York.
Yeah, that's why I always say that if agencies or directors of agencies don't start to have some type of creative thinking on how to engage the community and how to I think a lot of people, first of all, the perception of home care has to change. That's number one. And bringing new people and new life into home care and showing them that it's a good job, it's a sustainable job. I mean, is it the highest paying job? No, but does it give you other feelings, good feelings when you do the job? One of the things that we do also at All Things Home Care is we're fighting for fair pay for home care workers.
Right.
So the wages have to go up. So I think as we engage the community and as we think of all these other interesting things of how to have them come in, hopefully it has to change, because if not, this crisis is going to continue.
I also think that we have to put out there that when you're a union agency, it's not just the $15 an hour, let's say, it's also the benefits. It's time off, it's pension, it's sick pay, so that it's insurance for others. So there are a lot of other things besides the flat hourly rate.
Well, I think union agencies legitimize the job, right? It makes it a profession, not just an opportunity. Because one of the things with the union is what made me happy was that I feel like you're engaging that worker and you're giving them a reason to stay, not a reason to bounce from company to company. So although an agency like other than Best Care Reliance, they might pay them 25 cents more an hour, but that 25 cents is really not 25 cents. And it's less. But when you're in a union agency, you have all these other things that can help make your life better. And hopefully people will start to see that and start to come back into home care, because it's a good job. So I thank you guys for the opportunity of coming here today. But before we wrap up, is there anything else that you'd like to bring attention to or have a conversation about?
Well, I'd like to emphasize to the nursing students and anyone interested in home care, It's a great opportunity. It's a great learning experience. It's a good give and take. You learn a lot. And for the nursing students, it's a great experience for them to come in and just get their feet wet, understand what home care is, understand what it means to care for a client in their own environment, to be respectful of that space, and really just improve the quality of a person's life.
That was very well said, and I agree with you 100%. We need to take a short break. We'll be right back.